Hi everyone, my name is Dr. Rama Shankar and I am a public health professional. Today I'll be talking on some of the important public health interventions which should be initiated following a confirmed case of measles outbreak. Now, in measles elimination setting like India, a single case is also considered an outbreak and it needs a public health response. Now, the first component of public health response should be contact tracing. We all know that we need to trace the contact to identify the source of infection and also determine whether other areas have been exposed or are also experiencing the outbreak. We need to identify all those people that the case had contact with during the time he or she was contagious. For example, in measles 4 days before and 4 days after the onset of rash. We need to also make the line list of all these contacts. Now, it may not be feasible, to identify all contacts during a large outbreak due to time, resource, and logistical constraint. So, in such situation, what we should do, we should deprioritize the contact tracing, and a large public health immunization campaign or response should be initiated with risk communication and awareness campaign. So in such cases, following groups should be prioritized. For example, household contacts, school contacts, daycare contacts, childcare contact, workplace contacts, healthcare facility contacts. Now, to the actions which we should initiate to minimize the spread is we need to identify those contacts who cannot provide any evidence of measles vaccination should be vaccinated, and they should be explained about the symptoms of measles. And during the second week after exposure, if there is a silent symptom of measles like fever and rash, the contact should be instructed to stay at home and the follow-up should be done, and if they are seriously ill, then laboratory diagnosis should be initiated. Now, coming to the second component of public health response should be enhanced case-based surveillance and active case searches. We need to do active case searches in the community, in the schools, and in the villages. And for that, what we do, we take a radius of 100 to 1,000 meters from the confirmed cases, and we try to identify cases of suspected cases of measles. In addition, the health facility should be also included for active case searches. We need to interview the staffs, we need to review the registration records, the discharge certificates, the diagnosis, the hospital charts, and etc. Now, the third component following contact tracing and active case searches should be to assess the population immunity gap. So we need to review the trend of measles first dose and second dose vaccine coverage, and if we identify a serious immunity gap, we need to plan an immunization drive. Now, the immunization drive can be in the form of outbreak response immunization, or it can be a supplementary immunization activity, and all the targeted children who doesn't provide any evidence of vaccination can be vaccinated as per the national recommendation. The last one is we need to also ensure the isolation of suspected cases. So all the cases, confirmed cases, need to be isolated. Mild cases can be managed at home, just to ensure that they stick to the recommendations, the treatment guidelines given by the doctors, and they are in frequent touch with the concerned treating physician. The seriously ill cases need to be managed in the hospitals, and we all know that measles is highly contagious and in fact very infectious. All hospitalized children with suspected measles should be cared in an isolation facility. I'm sure adhering to all these public health responses will definitely minimize the impact of outbreak and help us to prevent further outbreaks. With that note, thank you very much.